Good afternoon. I'm Victor Chang, President of Chinese American Medical Society. My honor to introduce Dr. George King, who is the Thomas J. Beatson Professor of Diabetes at Harvard Medical School. You may know Dr. King already from the fact that he had received our scientific award in 2012 and had spoken to us about COVID-19 and diabetes just 2 years ago. And not content with scientific research, has been applying and showing us how to apply this knowledge of practical care to the Joslin Diabetes Asian American Initiative. And today we're honored to have Dr. King here today to speak about diabetes and Screen at 23.
Okay, thank you, Victor, for giving me the opportunity to speak about our screen and encourage everybody to screen for diabetes in your patients. So let me see if I could share my screen. Give me a second. Okay, great. So this is the slides information about Screen of 23, and which was launched about 4 years ago on a national level with all the organizations that have listed there. Now, the reason we want to screen Asian Americans with BMI of 23 is because the prevalence of diabetes for Asian Americans is shown here in the Anhang study, which just included Asian American in the study in 2011. So this is data from the first Asian American data on diabetes from 2011 to 2014. As you can see on the blue bar, the Asians have very high rate of diabetes, but it's even more important, look at the green bar. This will be the fourth set of bar from the left, that Asian American have highest rate of undiagnosed diabetes of any of the groups. Now, this is the most recent data, which is very hopeful, showing that increased campaign for awareness of diabetes is working. So on the left is total from 2011, 2014, then the latest data, 2015 to 2018 from the Anhang study, show the total diabetes prevalence in Asian Americans about went from 15.8 to 16.3%. The diagnosis rate from 9.3 to 11%. But the really exciting thing is the undiagnosed rate was at 6.5% at 2011 to 2014, but now is 5.3%. So if you look at the bottom of the slide, it says undiagnosed percent of the total have actually decreased from the first set of study of Anhangs of 41% now to about 33%, which is about the normal range for other ethnic groups as well. So the campaign to increase awareness is actually working. So just quick refresher for everybody, there are two main types of diabetes. Type 1 is autoimmune, mostly in the past is called children pediatric diabetes, juvenile diabetes, but it's actually much rarer in Asians, 5 or 10 times fewer in Asians than other ethnic groups. Type 2 is the most common one in Asians, and it's related to not being active, obesity, aging, but in Asian American, it occurs much lower BMI or body mass index. As shown here, this is data actually from New York, that if you look at the percent with diabetes of different ethnic group, white, black, Asians, and Hispanic, if you light blue bar is the Asians. So Asians have the highest rate of diabetes with low BMI, that's 25, it's considered normal BMI. And blue bar, again, is very high for 25 to 30 and 30. But for all the other ethnic groups, it continues to go up between 25 and 30. So for reasons not clear, Asians, especially the East Asians, develop diabetes at very low body weight. Now, when you're screening for diabetes, what can you do? Well, most people doing now is either fasting, which is hard to do, or just order a hemoglobin A1C. In general, most people use 6.5%. But the data from Arenada and Filipino Americans show that A1C of, if you use 6.5, you'll miss almost 50% of the Asian Americans. So we recommend for screening purposes is using A1C for Asian American of 6.1%, which would be most of the, we'll get 95% of people with diabetes who are Asian Americans. Now, it's also very important to screen for pre-diabetes, or in the past we call it impaired fasting glucose or glucose intolerant individual. And there, the A1C is between 5.7 and 6.4. So this is the reason we want to screen for pre-diabetes is people who have pre-diabetes have already increased risk for cardiovascular disease and maybe even Alzheimer's. So, but also that we can have plans, and because that's actually preventable from developing into type 2 diabetes. There's a huge study that was done 20 so years ago. It's called Diabetes Prevention Program by NIH, and it clearly showed that it's shown here that either lifestyle or treatment with metformin could greatly prevent type 2 diabetes. So the green is placebo, dark blue is metformin, but the lifestyle is actually the most dramatic positive effect. So that's diet, lose weight, and other things. So how do you prevent type 2 diabetes or even reverse type 2 diabetes, which would be medication, but that's not for pre-diabetes. Certainly healthy eating, stay active, sleeping is a huge importance, stay positive, which is hard to do, and healthy weight. Now, if Asians are already low in body weight, how do you tell them to lose weight? Well, the good news is for Asians, you don't have to lose that much weight. So essentially, we're talking about 5 or 10 pounds, or get close to BMI of 23, you already have a very dramatic positive effect. Food, nutrition, I heard Dr. Hu did a wonderful job, who's a good friend of mine, yesterday, so I won't go into that. But the main thing is decrease your animal fat or protein, lower fat content 15%, but double your fiber, 30 grams of fiber a day. Now, these are the common food I eat, and that's what very, very helpful. And this is a picture of some of the traditional Asian diet we have come up with. So if you want details, look at AADI website, and we have recipes for 10 days. They're very, very good and very nice to look at. So it's not suffering. Now, people, exercise is very important. So we're just asking people to walk about 7,000 steps a day or 45 minutes a day. And you can walk around the block. This is a time when you could relax and so forth. So I think it is very enjoyable and for the exercise as well. For those who have joint problems, swimming is one of the best things you could do. Sleeping is incredibly important. And for the silver study show, for some reason, Asian American of all the ethnic groups have the least amount of sleep. And we should sleep for some reason less than 6 hours a day. So very important to sleep 7 to 8 hours a day. That could really decrease inflammation in your body and also decrease rate of diabetes and improve your diabetes care. This is probably the hardest part, reduce stress and managing your mental health. I don't know what to tell you except to, what I do is, again, I walk around the block and slowly, and then it's a good way for me to relax. But everybody finds their own way of doing things. So let me just finish up here. It says we have a national campaign, Screen at 23. Many of these organizations are helping us, ADA, CDC, coalitions of Asian American, Native Hawaiian, Pacific Islanders. It's already passed. This resolution has already passed by 5 states: Hawaii, California, Massachusetts, Illinois, Washington. It's pending now in Oregon, Ohio, Maryland. We hope New York will join us soon, and we need all your help. And if you need more information about all this topic that I have spoke about on screen 23 or pre-diabetes, diabetes, we have a book out there, as well as AADI website contain all this information. So thank you.
Thank you, Dr. King. If anybody has any information, if anybody wants more information, please feel free to visit the Screen at 22 booth on our website. You can go to their booth in the exhibitor page. Our next session is actually starting now. State of the Science. Please return to your agenda and click on the next session. We'll see you there. Thank you.
November 30th, we'll be having a seminar for those who are interested in more information.